Choosing a healthcare provider is sometimes an emotional decision for many individuals. At Community+HealthNet, our goal is to ensure that our patients receive the quality of care that they deserve.
Hello, I'm Dr. Janet Seabrook, Executive Director of Community+HealthNet, one of the federally qualified health centers in Lake County, Indiana. Federally qualified health centers receive funding to provide quality health services to the uninsured and underinsured in their service area. Community+HealthNet has been in existence since 1998, providing quality, comprehensive primary health care services to the patients of our community. Some of the services that Community+HealthNet provides are pediatrics, obstetrics, and family medicine. The mission of Community+HealthNet is to create and provide a medical home to patients in our community. When I say medical home, I am talking about things like being able to say who your doctor is, where your physician is located, and that you have a primary team that's taking care of you, that knows you and understands you. These are the same people that you see out in the neighborhood and in the community, who are also the people who are providing health care services to you.
I'm just excited to be here to talk about Community+HealthNet and the growth and experience that we're having at Community+HealthNet. As Director of Operations and Compliance, we are organizing, structuring ourselves where we continuously, for the last 16 years, are providing quality, dignified, humane medical services to the spectrum of people who live in Lake County, Indiana. From the person that has insurance to the person who's not insured. Everyone is welcome at Community+HealthNet in order to take care of your mind, body, and spirit.
I think it is very important for a health center such as Community+HealthNet to exist within a community, particularly a community such as the City of Gary and Lake County. A few years ago, there was a study done that identified both Lake and Porter counties as being the two unhealthiest counties in the state of Indiana. With that being said, it is very important to identify those health organizations that can develop the services or render the services that are needed to make our communities healthy.
I'm very involved in the peer review that goes on and making sure that every day procedures are being followed and that we're writing policies up of how to follow up with labs, telephone calls, other procedures that need to be done for patients so that everyone is given good quality care here. We also are very involved in the community in going out to all the Boys and Girls Clubs in Northwest Indiana and providing physicals for those kids that parents maybe have trouble getting into a regular physician so that they can at least get a yearly checkup done. I'm also involved in doing sports physicals to all the high schools in Northwest Indiana, not only in the Gary community, but we go out into the Hammond, Lake Ridge community, so that all kids have the opportunity to be able to participate in the sports that they have at their high school if the parent, again, is not able to get in and have the physical done.
Covering Kids and Families is a program that is designed to advocate health coverage for individuals, families, adults, and children into the state's health coverage program. This is for Hoosier HealthWise, the Healthy Indiana Plan, or Medicaid. As of October 1st, the implementation of the Affordable Care Act has come into place, and so right now I am also a certified Indiana State Navigator, and I am also a certified application counselor designed to assist families or adults into applying for these said programs.
Centering is an alternative to traditional prenatal care. You still get the prenatal care that you would get, but it's done in a group setting, which consists upon women starting at the gestational age of 14 and 18 weeks. It's more of a bonding thing as well as medical, as far as because you can't be healthy physically if you're not healthy mentally. So it also helps with that part of being pregnancy because of all of the emotions that you have. So they're all touched upon during that session.
We have really good external relationships. We have an ongoing relationship with Methodist Hospital. We're also working on trying to have relationships with some of the other hospitals, St. Mary's, Community, because as we broaden our scope of work, we've moved out of the city of Gary, so we need those external partners to be able to do some of the things we do. We have a great external partnership with our AID-Serve organization. We've just recently started back doing HIV testing so many days a week down at the Fifth Avenue site in Gary, and hopefully once the Maryville site is up and running, we'll be doing that there also. And we have a wonderful relationship with the city of Gary, especially our current mayor, Karen Freeman Wilson, has a broad understanding of what the health center does and how imperative it is to the city of Gary.
As a federally qualified community health center, Community+HealthNet stands by its mission to provide affordable and quality medical services to individuals in need of medical treatment, regardless of their ability to pay.
Since opening our doors, Community+HealthNet has provided more than 10,000 individuals healthcare services. This year, I'm happy to say that Community+HealthNet is on target to meet its goal of having over 30,000 individual encounters unduplicated in our 5 locations throughout Lake County. As the Executive Director of Community+HealthNet, it is my vision that we will continue building a network of better health care throughout Lake County.